My name is Kate Berman. I am the Community and Corporate Relationships Manager at the People Concern. Please allow me to formally introduce Debbie Fox, Deputy Director of Policy and Practice at the National Network to End Domestic Violence. She is our incredible moderator today, and we're very lucky to have her. So without further ado, welcome, Debbie.
Hello, everyone. It's great to be here with you all. Thank you, Kate, for the introduction, and thank you for the People Concerned for bringing us all together today virtually. I just want to say welcome to our webinar and discussion. We're going to be talking about ending homelessness and the prevention pieces around that in this series. This is the second discussion in this Ending Homelessness panel series. We're really excited for you to join us for what promises to be an engaging and an informative conversation with many thought leaders from programs that can help to prevent and solve homelessness. So today's conversation in particular will tackle the topics that many of us are working on, wondering about, such as the solutions and the different innovations that are taking place that are working to solve homelessness, the successes we can see in the programs that we work in that are reimagining the social safety net, and how we can shift our views and change the way that we're doing our work and our services to improve people's lives and make services better for everyone. So we have a lot to cover today and a great discussion ahead. So I just wanted to introduce our panelists. So today we have three panelists from organizations in the LA area. First, I'd like to introduce Mark Loranger, who is the president and CEO of Chrysalis. We also have John Maceri, the CEO of the People Concern, and we have Nick Salazar, who is the Chief Operating Officer for the Fund for Guaranteed Income. So they're going to tell you a lot more about themselves and the work that they do as we move through the questions and the discussion. And I just also wanted to mention that we are going to have a Q&A at the end. We are going to make some time for that in this hour. So if you can please have some questions in the chat, we will be happy to answer them. And if there's any discussion or dialogue you would like to have, please do that in the chat box as well. So we're going to go ahead and get started. We have a lot to cover. And we just wanted to begin having the conversation to talk about the different organizations and what each organization does to prevent or reduce the likelihood of someone falling into homelessness. So I would like to start with Mark, if you could introduce yourself, your organization, and talk a little bit more about how you're working and your organization is working to prevent or reduce the likelihood of someone experiencing or falling into homelessness. So Mark, it's all yours.
Sure. Thanks, Debbie, and thanks, John and Nick, for sharing the stage with you and everybody that's tuning in today. I'm Mark Loranger from Chrysalis. So at Chrysalis, we help people that are navigating barriers to the workforce by providing a job readiness program, individualized supportive services, and paid transitional employment. At its core, what we're trying to do is help people prepare for, find, and retain employment. And typically, the clients that we work with at Chrysalis have experienced homelessness, they've had interactions with the justice system, or faced other systemic and significant barriers to employment. They're ready, willing, and able to go back to work, but they just can't quite figure out how to do that, and they need a little assistance. That's where we come in. We've been at this work for 37 years in Southern California. We now have 5 centers in LA and Orange County, and are about to expand also into the Inland Empire. Just to give you a sense of size and scale, last year we helped about 1,500 people find permanent outside employment, as we call it, not working for us, but we also employed 1,600 of our clients on a temporary basis in one of our transitional jobs businesses, so they can get that experience that they need to then move into another job. You know, from our perspective, a job is important on many levels. It provides the income and helps us pay our way, of course, but it also means dignity. It means self-respect. It means to be able to connect with your family and with your community. And when we think of homelessness and some of the issues we're going to be talking about today, there are so many interdependencies here. And I know we'll touch on many of those later this afternoon. So I really appreciate being able to be part of this conversation.
Thank you so much, Mark. I'm going to go ahead and turn it over to John, who has a lot of experience being at his organization for over 22 years. So you've seen a lot of changes in the field. So if you want to tell us a little bit more about your organization and what you're doing to prevent homelessness, please take it away.
Thanks, Debbie. And I want to thank you, Nick, and Mark for joining the conversation today. We really appreciate it. And thank you to everybody who's participating in the webinar. So the People Concern will be 60 years old next year, and we provide housing and services to people experiencing homelessness and victims of domestic violence. And we do that in a variety of ways, beginning with street outreach teams. We field about 18 multidisciplinary street outreach teams in various parts of the county. We operate about 700 beds of interim housing, currently about 2,800 units of permanent supportive housing. And then we have wraparound services, so mental health, domestic violence, primary care, and substance use services. Our work is largely focused on working with people after they become homeless. However, in the last few years, through the efforts of Measure H, we have expanded the prevention side through what's called rapid rehousing and problem solving. So trying to divert individuals as they are perhaps not yet experiencing homelessness or keep them from falling into homelessness. And we have found that that has been very effective in keeping people who are either currently in their housing housed or people who have recently fallen into homelessness to move them out of homelessness as quickly as possible. And that, of course, is made possible through our collaborations with Mark and Chrysalis. As people get their incomes up, are able to go back to work or to get their incomes up in a way that they can sustain themselves in permanent housing.
Thank you, John. I'll pass it on to Nick next, who has a work around guaranteed income and has been doing that work for a while and scaling up that, and also just different innovative approaches to addressing homelessness. So can you tell us a little bit more about your work at your Fund for Guaranteed Income?
Yeah, thank you so much, Debbie. And thanks, Mark and John, for having me in the conversation. My name is Nick Salazar. I am the COO at the Fund for Guaranteed Income. I use he, him pronouns. At the Fund for Guaranteed Income, we are about proving a viable pathway to guaranteed income. And what guaranteed income are direct, recurring, unconditional cash transfers directly to people who are locked out of the economy and welfare systems. And we often do this work in partnership with a government or a community-based organization that has been in the community for a long time. We disperse these payments on a payments platform that we have built, that we co-developed with community, and that offers access to local resources as well as payments on 4 different payment methods. So through direct deposit, prepaid debit card, Venmo, PayPal, so providing flexibility to folks for them to receive the funds however works best for them. As I mentioned, the funding is unrestricted, and so people can use it for whatever it is that they think is best, whether that be rent, food, medicine, to spend on themselves, their families, or to invest in their careers. And our goal at the Fund for Guaranteed Income is really to create a space in the guaranteed income space for people who are really excluded traditionally from these welfare systems. And these are folks, for example, that are undocumented, that are formerly incarcerated, that are unbanked or underbanked. And the work that we do is largely serving to design programs and products that work better for these people.
Thank you, Nick, and thank all of you for just giving us an overview of the different ways that you're trying to address or prevent homelessness, from employment to housing to just innovations around cash, unrestricted cash, that can really help people who otherwise might fall into homelessness without it. So I wanted to talk a little bit more. You talked a little bit about serving various different populations, those who don't have access to typical systems or maybe benefit systems, or survivors of domestic violence and families. Can you talk a little bit about the barriers you see within the populations you serve, what they're experiencing, and what they're talking about when they're coming to access resources or wanting some of the guaranteed income things that you're talking about, or housing? What are some of the barriers in the populations that you serve? Nick, do you want to talk a little bit more about how that work is looking and what people are bringing forth when they're coming to request services from you?
Yeah, absolutely. So at the Fund for Guaranteed Income, we run one of the largest guaranteed income pilots, city-based pilots currently operating in Compton, California. And we also have programs in a couple different sites around the country. Fund for Guaranteed Income works primarily with low-income communities of color. And for these communities, the barriers that are faced here are not new. These are long-standing barriers, and a lot of times they're deliberate. These are communities that have been systematically barred from pathways of economic development throughout history, and it's a really deliberate form of underinvestment. For example, 65% of Black Americans were made ineligible for Social Security when it began, and that was followed by the legal exclusion of Black people from wealth-building apparatuses like the New Deal and the GI Bill. Today, discriminatory social services and tax laws continue to provide fewer resources to people in neighborhoods of color. And so that is kind of the context, the historical context in which we work. We know all of our organizations and the people that we serve changed a lot during COVID. And the disparities that we see in a community like Compton worsened a lot during the COVID-19 pandemic and continue to be bad. Public health outcomes were worse here. And we saw in Compton some of the widest racial disparities in unemployment in recent history. What specifically around delivering guaranteed income benefits, I think there are two main categories. First is that there are barriers that come from people who are deliberately excluded from accessing benefits like we were just talking about. And this could be, for example, folks who are formerly incarcerated who are banned from food or cash assistance simply because they have a criminal record. Then there is, I think, another very, very large group of people who are practically speaking excluded from accessing benefits. And that could be, for example, because the burden to accessing benefits is too high. So for example, for folks who don't speak English, there may be a lot of systems actually that aren't translated. If you are undocumented, you don't have a social security number, or you don't feel comfortable sharing your information, that is another barrier. For those who are underbanked or unbanked, not having a bank account or not having a safe place to keep those funds can be a barrier. And then across the board, we have communities and individuals that have varying levels of digital literacy. And so as programs continue to move in the digital arena, whether it's devices or connectivity, that is yet another barrier for folks that we work with.
Thank you, Nick. You covered so many different ways that there folks are systematically by design or just the practical pieces of being excluded from accessing different benefits, and so much the need just for the guaranteed income and the kind of mutual aid or different pieces of people need to access if there's lack of systems working during this time. And there was such a light shown on this during the pandemic, and we were definitely have been discussing it a lot more. And I definitely think we need to continue to talk about these lack of access and some of the lack of historical access. So I think Mark is going to talk a little bit more as it relates to unemployment. You touched on that a little bit, and I think there's a lot of connections there as well. So Mark, if you could tell us a little bit more about the work of the barriers of folks accessing the job market. And I'm sure that there's some pandemic intersections there as well.
Absolutely. And Nick, I think, set it up really well in terms of who we serve at Chrysalis. It's all the folks that Nick was speaking about, folks that have been systematically eliminated or pushed away from the workforce for reasons that we can probably beyond the scope of what we're talking about today. But I was talking with some folks at the Department of Labor just this week and learned that we spend about $8 billion a year on our workforce system through the Department of Labor that gets distributed out to states and cities around the country. And yet the folks that we serve don't benefit from that typically because they're just hard to serve in the sense that they have a lot going on. They've got a criminal record. They may have an unstable housing situation. They may be trying to address some physical and mental health challenges. And you put all that together to expect them to navigate finding a job without some help is impossible. And that's where we come in. We serve folks that the traditional unemployment system is just not designed to serve. as much as it may try. Folks get lost in the system. As Nick was saying, the barriers to accessing benefits or other systems tend to be quite high. So we try to work with folks that can help them understand the potential that they have, not based on maybe the worst day in their life that happened in the past, but the future. And that just requires a lot of intensive one-on-one case management work. In some cases, some experiential hands-on work experience working for one of our businesses. But without that intensive effort, the folks that we're talking about would probably get lost in the system, as they have historically for many, many years. And the only way we're going to be able to address that is if we do this intensive work and specifically target it to communities that have been underrepresented and underserved for many, many years.
Thank you, Mark, for giving us a little bit of overview of some of the barriers that folks are experiencing. And I think that we're going to start to see some of the intersections here pretty quickly. John, can you tell us a little bit more about some of the barriers you're seeing for the populations you serve in the housing arena?
Sure. Well, I think both Nick and Mark have identified, significant barriers, because we are working with people who, by and large, tend to have many chronic health conditions that they struggle with, which create a lot of barriers in terms of navigating systems for entry into housing. They tend to have very poor employment histories, poor credit histories, often not good housing histories. And as a result, when they're competing in a very expensive and tight real estate market like we have in Los Angeles, they're competing against high earners and people who have good credit, have stable employment histories, have higher incomes. And so there's a natural disconnect that happens in terms of their ability to really access the limited housing stock. And you put on top of that the lack of affordable housing options that are available for people who are working primarily in low-wage jobs, or in many cases, for the people we serve, maybe living on a fixed income from Social Security or disability. It makes it even more challenging to access the housing stock.
Thank you, John. Yeah, when I was preparing for our conversation today, I looked at some of the out of reach, the National Income and Housing Coalition, some of the data there around what it would take to have a full-time job, and the wage that you would need to afford housing in Los Angeles is very, very high. And as you're saying, you're competing with high income wage earners. So it's nearly impossible to compete in that market if there's not enough units. And so I know we talked a little bit about the pandemic, but can you all talk a little bit more about how the pandemic has impacted your work? I know a lot of things went more remotely, we got more resources, but what are ways that you have seen changes, both positive or negative, that has impacted your work and your outreach to address homelessness and preventing homelessness in your communities? So Nick, I'll start with you again.
Yes, happy to. So the pandemic really exposed that the social safety net is failing people and failed people during that time. And I think specifically at F4GI, we saw the racial fault lines of the safety net and the frailty of the system overall. In Compton, we have 23% of people that live below the federal poverty line. And in Compton, during the pandemic, unemployment rose to almost 22%. An increasing number of Compton families relied on food pantries. People were unable to afford rent. They were unable to afford food, medication that they needed, transportation to jobs, if those jobs were still there. And something that Mark, John, and I have talked about, right, is that the pandemic is still ongoing. It's not something that is in the recent past. It is still happening now. It is still affecting families today in exactly the same way it was back in April 2020, maybe with a little bit more certainty, but more certainty around the difficulties that it has brought as well. And so, most people that we work with are still in it. That loss of income, those health challenges, everything else that comes with it. The people we serve were already worse off due to this deliberate underinvestment we talked about just last question. And they are particularly vulnerable because they didn't get the protection that millions of other people did. So for example, stimulus checks, the ability to work from home. Millions of dollars during the pandemic were deployed in disaster response as a kind of quick one-time solution to help bolster people during a really, really difficult time. But implementation of those types of programs were uneven. The benefits were not distributed equally, and it was short-lived. It only happened once. And it left out millions of undocumented people, millions of people who are formerly incarcerated, and who are still going to be struggling. And so I think that we have both the impact that happened during what we think of as like the core of the pandemic, but still that ongoing effect that's happening now.
Yeah, and thank you, Nick, for the reminder of we're still in the pandemic. I mean, that's really important. I know that there's kind of a talk of returning what to normal, whatever that means, but there's still so much in terms of the lived experience of what folks are going through, and because of the, like you said, the emergency responsiveness of it. You know, if there's not childcare, you're not able to go back to work, or if you might have long COVID. You know, it really changes the labor market and ability to get back into the workforce as we're still navigating the pandemic. So Mark, I know that you all are doing a lot of work with finding permanent employment and have had some successes, but can you talk a little bit more about how the pandemic changed that, and how you had to meet people where they were at, make those pivots?
Sure. In 2019, before this all happened, we had helped about just under 3,000 people find jobs. And by March and April of 2020, many of them were out of work again, right? So it's as if, oh my gosh, we did all this great work in 2019 and we've just set that back. To compound that, we, of course, like everybody, we're trying to figure out how do we deliver services in a way where we can't do it like we used to. We can't do it face to face. So we had to do that pivot. And then what we were hearing from our clients, this plays right to, I think, some of the points Nick's making, is that while they needed work and hopefully they could find work, we could help them do that. They also needed food, and they needed something to help them to not get evicted, and other basic supports, things that we have not traditionally done, but we ended up raising the funds and distributing nearly $1 million in direct supports to folks so that they could pay for what they needed to pay for in this really tough time. Fortunately, at the same time, we were able to pivot some of our social enterprises to grow quite rapidly. In fact, we partnered with the People Concern and a number of other housing agencies to help staff up for Project Roomkey. That provided up to about 300 jobs for our clients in temporary positions to help support those projects. And some of our other social enterprises provide essential services. And so they needed to, they were able to keep going. We were able to actually grow them. But I think it also, for all of us, put the spotlight on essential workers. And what does it mean for those folks that have to show up every day and take that risk that many of us have the luxury of sitting on Zoom like we are right now, right? In the comfort of my home office. The folks that we serve didn't have that luxury. They don't have that luxury today. This is still an ongoing pandemic. And we're discovering another major new barrier to employment that we hadn't thought of before, and that's vaccination requirements. Now, personally, I think getting vaccinated is a good thing, and it's the right thing to do. We have a mandate at Chrysalis that our employees need to be vaccinated. But for many of our clients, the communities that we serve, there's a lot of mistrust, there's a lot of misinformation, and the vaccination rates, for a variety of reasons, have lagged well below. And so those folks that are going to try to get a job now, if they're not vaccinated or they're not willing to get vaccinated, that's yet another barrier that they face. So the pandemic is not over, and I don't think we fully understand all of the consequences and the impacts to our community and certainly to the workplace as a result of what we've gone through the last couple of years.
For sure. Thanks, Mark. I think, yeah, for years to come, we'll kind of be parsing out the impacts and seeing, you know, kind of the increased disparities that have come out of this time. And I thought, John, you could talk a little bit more about your work in the housing arena, just what you focused on and how your services changed during that time.
Yeah, I mean, COVID for us, certainly in the first year and a half, really pushed us more towards, you know, back to basics. Access became a huge issue for the people we serve. And so we saw, especially as the public spaces started to shut down, so places like libraries and coffee shops where people on the streets traditionally would go to charge their cell phones or use a computer or access restrooms, none of that was available almost overnight. So we saw a doubling of the number of people coming into our access center just to access hygiene services, laundry, clothing, food, our public toilets and showers and laundromat downtown, the same thing. And our outreach teams were really engaged initially in making sure that people who were sheltering in place on the streets had access to PPE equipment. And then as time went on and the vaccines became available, and in between the beginning and the availability of vaccines, very involved in making sure that people had access to testing, because again, that was very limited, especially for the people that we serve. And then as vaccines became available, pivoting again to make sure that the people that we were serving had access to the vaccinations, which were very uneven, certainly in the first wave until the supply chain issues evened out. So there was a lot of focus on what I would describe as basic and emergency services. The other challenge is that, of course, it slowed down the pipeline for people moving into permanent housing, both those units in terms of getting units just inspected, making them available, being able to physically go and see the units, all of that was restricted. And so that just slowed down the time, or increased the time, slowed down the flow through for people to access housing. And then, of course, dealing with all of the changes in the workforce and people working remotely. And certainly we experienced, we have a lot of staff who have children in LAUSD. And so in September of 2020, when LAUSD did not reopen, we found a lot of workers who were in difficult situations. They were trying to hold down jobs and also take care of their children and homeschool their kids. So that has tremendous pressure and impact, on people's well-being and also their ability to, be fully present in order to do their work. So I'm happy to say that we are starting to see a shift, more towards non-emergency services, but there absolutely is still an ongoing need for access to PPE, to food, to all the basic things that people need to survive.
Yeah, thank you for naming that. Like there's we're experiencing collectively the pandemic. Well, while some of us in organizational leadership positions are in a more privileged position, there's still there's still a responsibility to community and the work in this leadership position. And it can be overwhelming to make some shifts and innovations during this time, as you're also doing that crisis basic services, like making sure people have access to cash and food and basic needs. But you all were able to do some innovations during this time while being under an intense amount of stress, and the people that work at your organizations under a lot of stress, personally and organizationally, as well as you're being responsive to people in your community. Can you talk a little bit more, though, how you were able to innovate during a really, really difficult time and how that helped the people in your community, be able to maybe prevent their homelessness or divert them from homelessness? Mark, could you talk a little bit more about that?
Sure. And I want to give a shout out to everybody that works in our sector, my staff, John's staff, Nick's staff, Deputy Sirs. They are heroes in this work and work tirelessly to make this happen. They're essential to our communities. And they're the ones that helped us figure out new ways to connect with our clients. Traditionally we have these 5 offices, you got to come to us and we provide in-person services. And that wasn't going to be possible beginning in March of 2020. So we had to pivot. And frankly, I was a little skeptical about how well it would work, but we found new ways of connecting with clients via phone, via text, via video, whatever it took, and distributing Chromebooks, distributing phones if necessary, And it's worked quite well. And so one of the innovations from all of this is we're going to be a stronger organization coming out of this, because we'll be able to provide more effective and more efficient services to clients in ways that are true to them and authentic to them. The other thing that we've realized, and this is no great shock to anybody on this call that lives in LA, it's expensive to live here. And that requires more than minimum wage. And yet many of the clients that we work with end up getting jobs at placement $1 or $2 above minimum wage. And that's good, but it's not a livable wage. So what are we going to do to change that paradigm? What are we going to do to shift that? And we've been investing a lot more of our time and effort in skills building and skill pathways that allow somebody to get to family sustaining wages. I'll tell you, it's not easy with the folks that we work with. They feel that they're not qualified for that. They could never do that. The thought of going back to school to pick up new skills, it's just a whole new world for them. And so our team has to work really hard to encourage folks to take a chance on themselves and invest in themselves. But when they do, and they get that welding certificate and they're making $27 as a journeyman, that's life-changing, right? For somebody that might have experienced homelessness in the past or been in the criminal justice system. So finding pathways that are appropriate and authentic for the folks that we serve is a big part of our focus right now.
Awesome. Thanks, Mark. John, could you talk a little bit about different housing models that are working on the prevention side?
Yeah, so I touched on this a little bit earlier. So on our work on the prevention side, which is more upstream to either help people from falling into homelessness, or if they become newly homeless, to lift them out of homelessness as quickly as possible, has really been focused on the rapid rehousing side. So to make an intervention as quickly as possible to get people into stable housing, provide a shallow rental subsidy for a period of time while they are working on getting their incomes up so that they're able then to sustain themselves over the long haul in housing. So that's something that's been effective. And then linked to that is the problem solving interventions, which is really kind of goes hand in hand. The goal is really to divert people out of the homeless service delivery system, if at all possible. I mean, what we know is that the longer people are on the streets, the harder it is to make an intervention and to break the cycle of homelessness. So helping people really find agency where there are opportunities and providing a level of support to them to be able to kind of get them to the next step. So that's really been our focus on the prevention side. And I would just say on the permanent housing side, and for anybody listening who's been following our agency for a while, we have been very committed, in the scaling and sustainability of the construction of permanent supportive housing that doesn't rely on the traditional financing mechanisms, because we can see that, our current pace and cost per unit, we are not going to be able to build our way out of this issue. So really looking at innovative ways to capture and maintain affordable housing stock through master leasing, adaptive reuse, new ways to build and to finance permanent housing so that we can get to scale, because at the end of the day, we are going to have to produce a lot more units for people if we want them to be able to be safely housed.
Thank you for that. I mean, we could have a whole other webinar, or maybe this part of your series on affordable housing and the need in affordable housing development. And so I think that brings us to our next topic. I'm hoping Nick can talk about some of the pilot work and the systems change and innovative work that they are doing around systems change. And I know we talked about earlier just some of the systemic issues and historical barriers and racism for many communities. But can you talk a little bit more of the systems change work you're doing, Nick, and what is the social safety net and what does that look like?
Yeah, thanks, Debbie. So FRGI is a relatively new org, even compared to some of the organizations in this call. And so we have a little bit, I think, the benefit of being able to try something new without having a lot to manage around that. And for us, that means guaranteed income that is inclusive. So includes the people that we talked about earlier who are normally excluded from these systems. That works better because it's designed with the wisdom of the communities it represents. Some who, by the way, have been doing guaranteed income for years, without it being recognized as such, and with an eye towards permanence. And our theory of change is really about understanding what is broken with these systems, building an alternative, but then also organizing around coalitions that can demand that it be put in place permanently. And we work with guaranteed income pilots, and that includes both research and narrative work around shifting perception.
Are we all on? We lost Nick? All right, well, let's see. Hopefully his internet will come back in a moment. But I think we could go on if you want to talk, Mark, around some of the inequities that you have seen in your work over the years, and why you think there's a need for systems change. And I'm waiting to see. Nick, are you back? Okay, great. Can you hear me?
Yeah, am I here?
You were here. We lost you for like 30 seconds. All right, welcome back. So
Got it.
Keep going.
Yeah, anyways, we have technology, we have a payments platform that we have been continuing to develop. And then we're really focused on building a space within guaranteed income led by movement leaders in the racial and economic justice space, and to represent those who are most directly affected. And so that's incubating programs and leaders within the broader racial justice movement and supporting coalition work to the long term. And I'll just round that off by saying that for me, the social safety net is really important because it is a commitment that we make to one another to support one another through these hard times. And so it's imperative, I think, that we honor that and also work towards improving it.
Thank you, Nick. I think the last couple of years have really shown why we need a social safety net in this country, and hopefully we can continue heading in that direction and talking about it. So Mark, can you talk a little bit about the inequities that you've seen in your work over the years?
I think the current labor shortage that you're hearing everybody talk about these days has really shown the spotlight on how we have not effectively created opportunity for everyone in our communities. We do. The good news is we see a lot of companies that are changing their hiring policies, companies that would not have considered folks that might have had interactions with the criminal justice system in the past are setting aside those policies and looking more at the person and the potential as opposed to what might have happened 15 or 20 years in their past. And that's great. It's unfortunate it's taken as long as it has, but we are seeing progress there. Maybe it's just being driven by the way the markets are. I think when I am in conversations with folks about homelessness, about some of these core issues that we're talking about today, we need to get real about the scale of the problems and how much it's going to cost to fix them, because these things didn't happen overnight, right? And yet we've ignored them, unfortunately, or underinvested. Our housing stock hasn't kept stock. Our social policy and safety net has not been adjusted for inflation or other realities of living in California or Southern California. And so it's going to take a lot of time and effort to get out of this. All of the work that we do is human services work. It involves people to people connections. There's no simple app that fixes these problems. And that just means it's expensive. We have to hire good people to go out to do this work. So it's not just, we always talk about the cost of per key on construction. And I know John knows that all too well, but it's not just that. We all have to have really great people to do this work. And that is an investment that our community has to decide. Do we want to invest in what it's going to take to solve this problem? Or do we want to just talk about it and frankly complain about it, but not invest in the reality of what it takes?
Thank you, Mark. I think it's a lot more expensive, and there's a lot of research on that in terms of not addressing these issues. So I do think that, yeah, having the upfront investments and the preventions really makes a difference. And John, can you talk a little bit more about the systems change that you think needs to happen?
Sure. Well, there's a lot of it. I think Nick and Mark have identified, some of them. I think we have to acknowledge that there are, structural and institutional barriers and systems that have excluded people for a very long time. And that's just the cold, hard reality of it. The pandemic didn't create those systems or institutions or those barriers. They've been here for a long time. And what it has done is, I think, lifted up what we all have known for a very long time, which is, those who have get more, and those who don't don't. And so, that's so on a go forward basis, I would say there, are a few things. Certainly, when we think of the social safety net, I don't think the current social safety net, what's left of it, really works for the majority of people that it's meant to catch. And so we have to, I think as a society, hit that head on, because we have seen, I think, again, COVID did not create these disparities, but it certainly exacerbated them. That for people who are very poor and who have been marginalized and who have been excluded, that continues to this day. For the people, and that's not just people experiencing homelessness, because we tend to work with very low income and poor people generally. And so, there are social determinants of health, that have been present in communities for generations, that need to be addressed. So, people don't just wake up one day and become homeless. There are, a variety of ways that people, find themselves becoming homeless. And there are many ways that keep people homeless for much longer periods of time than necessary. So for me, it's not either this or that, it's all of these things, together, lifting people out of poverty, addressing the structural and systemic barriers, and calling out the racism that is there and has been there and continues to contribute to keeping people poor and outside of various systems, including housing. Those are all realities, and we have to come to grips with that, and not just acknowledging it, but the question, I think, is what are we going to do about it, going forward? And then finally, I would say on the housing front, and this is, probably, painfully obvious, but it needs to be said that the, affordable housing crisis that we have didn't start overnight. It certainly didn't start with COVID. This has been decades of bad public policy and disinvestment, which has now created, we really have reaped what we've sown. Now it's come home to roost in a significant way. And so until we create affordable ways for people to house themselves and remain housed and have access, to home ownership, so people who are working can keep a roof over their head, until we do that, on a scale that's significant enough to be able to bring more people indoors, more importantly, keep people who are housed, we're going to continue to be chasing our tail on this issue.
Thank you. Yeah, there's so many great points were raised of there's all different ways that we need help in our lives and need a social safety net at various stages of our lives. And we have experienced a particular health disparities crisis with COVID, but also that the healthcare system and the housing systems and affordability around housing has been with us for a very long time, and that we're in the, still in the midst of this economic crisis. So we are trying to save a little bit of time for questions and answers at the end. So we just have one final question for you all to ponder, and then we'll move over to the Q&A portion of the discussion. But let's talk a little bit about what your program goals are to prevent inequities in your community, and then also how that relates to the homelessness work that you're doing, and how do you balance the needs as you talked about, some of the crisis immediate needs of just, food and access to healthcare, with also long-term solutions of a safety net, guaranteed income, safe and stable housing. How are you all doing that work around the equity and the racial and gender equity lenses in your work? And so, John, I'll start with you.
Yeah, I think we've touched on it all of us in various ways throughout the conversation, but I would just say, for us at the People Concerned, there are a few things. I am increasingly concerned when especially now in the last 6 months or so, there's an enormous amount of pressure to just move people off the streets, just move them indoors, move them anywhere indoors, put them here, there, it doesn't matter, just get them off the streets. And there is not really a long-term focus on what happens next, because those individuals are still homeless. So absolutely, I support doing everything we can to eliminate immediate human suffering, but the question is, then what? And so if we are not creating, permanent pathways, not just to housing, but to employment, to income, to the things that are really going to transform people's lives so that they have agency over their lives and are able to care for themselves and their families, then we are going to continue, I believe, to struggle with this issue. And it is an issue of equity because by and large, it impacts disproportionately people of color. In Los Angeles, Black people make up 8% of the population, but 34% of people experiencing homelessness. And that statistic holds consistent if you look at urban homelessness across the United States. So we have to own that, and we have to acknowledge that there is a lot of work to be done around issues of access and long-term solutions to people's homelessness. So shuffling, people from one side of the street to the other, or one neighborhood to the other, or into a temporary housing situation, which is not going to lead to long-term housing and is certainly not going to lead to increased income in a way that's going to support people in sustaining themselves over the long haul, in my view, is not a solution. And it's not equitable because it will continue to disproportionately impact people who are poor and who will remain poor without significant, I would say, tectonic shifts in not only the way our current social safety net is administered, but just in terms of access to resources across the board.
Thanks, John. And Mark, can you talk a little bit about from the employment perspective?
Yeah, we touched on a little bit before that the current labor shortage is putting pressure on companies to think differently about they hire, and I can only hope that continues, and it's not a temporary blip because of a short-term imbalance in number of workers and number of job slots. Let's hope that the folks in our program that are working for somebody right now, that employer will remember that was one of the best hiring decisions I ever made, and that's one of the hardest workers I've ever met. That's who we work with. I get to see them every single day. I also think being real about wages that allow somebody to live in LA is really a crucial conversation we all need to have. Larger companies, we've seen some major shifts in their hourly wage. I think Target announced recently that for some of their entry-level positions, they're going to pay $24 an hour, and minimum wage is $15 an hour currently here in LA. So they are clearly recognizing that that's what they need to do to run their business. It also happens to be the right thing to do to allow somebody to survive. I run a business as well. I've got 600 people that were paid this week, clients that work for us, and we've made the commitment to move all of our workers to $18 an hour. And that's going to cost me a lot of money, and my team has to find a way to get it, but it's the right thing to do to at least recognize the contribution, the economic contribution, and the moral contribution that these folks are making to our communities.
Thank you, Mark. And Nick, can you talk a little bit about the equity work and how there is abundance and resources for this in your state?
Yeah, I know we want Q&A, so I'll be quick. The money is there. We know it's there. If you look at the budget, there is a surplus. We know that the infrastructure is there to support people. We already spend a lot on this. Sometimes I think the trust in community to deliver these solutions is not there. We know that it makes not just sense morally or ethically, but also economic sense to invest in people and communities, and that the economy benefits many times over from that initial investment. And just from an equity lens, the last thing I'll say is that these issues are very related. As John just said, Black people are overrepresented 4 times the general population in terms of experiencing homelessness. And so looking at these issues as related is not just something that's fashionable. Equity is not just fashionable, but it is literally necessary in order to understand the problem and do the work that needs to be done.
Thank you, Nick. Yeah, I agree with you on that. And just, this more than a press release statement. There's work that needs to be done and restructuring. And I think John mentioned the tectonic shifts that need to happen to really change, to have an equitable and racially equitable country. So I want to go to the Q&A portion. We have about 10 minutes, so we'll do a little bit rapid fire Q&A during this portion. So we have a question for you, John Maceri. So I said your full name again, I guess, just because it was typed in the box. So there you go, making it official. So we have a question about just some of the intersections around homelessness, mental health, and addiction. So isn't it, they kind of want to know, is it really the problem is not availability of housing, but is it more of a problem around mental health and addiction? Can you speak to that?
It's both. So we have to accept that there are, because of the way our social safety net is currently structured, that there are a lot of people struggling with serious and persistent untreated mental illness and substance addiction. And the streets have become open air asylums for those people because they have not had adequate access to care and treatment. That's just a fact. We don't have enough inpatient beds on the mental health side or on the substance use side. And there's been a lot of work, that has been done and continues to be done to push the county public health department and Department of Mental Health to expand those options. And so de facto and by default, people end up on the streets. And so we see that playing out every single day. And it is also accurate that we do not have enough affordable housing for people, whether they're mentally ill or substance addicted or have chronic health problems, or they have none of those things. They're survivors of domestic violence, or they may not have any of those barriers, but they are, at least currently, not able to afford housing. And so the way forward is to provide adequate affordable housing with wraparound services. I'm not advocating for, nor have we ever advocating for, sticking people in housing who need support. What we have advocated for is the supports necessary for people to live as independently as possible, to have care and treatment, so that they're not living on the streets, and so that they can live full lives. So it's not either mental illness or addiction or housing, it's all of those things together.
Yeah, thank you, John. And I always think about just how much of experiencing homelessness is a trauma. And if you didn't have some mental health issues or concerns, or addictions, like experiencing that trauma is really, you're experiencing a normal reaction of addressing the trauma by possibly substance use, because it's very hard to live outdoors and live on the streets. So the next question is around implementing some of these programs we've talked about. So Nick, could you talk a little bit more? How do we successfully implement these programs when we are witnessing rising poverty and job inequity? So I guess, how do we take some of this stuff to scale when we just see more inequities and happening?
Yeah, that's a great question. I think sometimes today it can feel like the largest amount of effort is required to produce the smallest change. And that is something that is very real. At the same time, there's a lot of amazing work that is being done. Sometimes it's not always visible or highlighted, but in whatever community you're from, there are community organizations that are doing amazing work, that have decades of experience serving constituents and people and residents that live in that area. And often there's a lot of wisdom and implementation expertise, and it is expertise. We don't always think of it that way, but expertise in making this happen at the scale of a community. There are also lots of work being done. For example, in guaranteed income, we are thinking bigger and bigger about how to scale these programs, how to finance them in the long term. So I think that expertise is there when we do listen to community, and when we are willing to, I think a little bit differently about some of the underlying assumptions about the programs.
Thank you, Nick. Yeah, I think that you've talked a lot about in the last hour, just how guaranteed income addresses poverty. And we've learned a lot, I think, the last couple of years around stimulus checks, child tax credits, or an income tax credit, that actually it's, sometimes just flexible funding and money for people can really do some of that work, and it doesn't have to always be implementing a program per se. So I wondered, Mark, if you had anything to add to that question, just around the job piece and equities. How do you think we can implement these programs when there's just more of a demand?
I think it's, as we were talking earlier, helping employers understand the untapped potential that we have in our communities. It solves a business problem for them. It's also the right thing to do, and keeps our focus on the commons as opposed to just what I got, I'm fine, never mind. Sometimes I'll talk to an employer that has hired one of our clients, and they'll just talk about the change in their workplace because that person that was formerly homeless, that might have been ignored by their coworkers, is now part of their team. And you get to know her or him as a person. And I think that's so much of the challenge that we face as a community is it's us versus them, or that person that I want to navigate around, as opposed they're our brothers, or they're our sisters, they're our neighbors, they're people. And somehow finding ways to have real engagement, I think, will help break down some of this negativity that we are constantly facing.
Thank you. I think it's so critical what you're speaking to, the cross class and cross racial, is just how we can work together, and how that really makes a difference. And I have one last question for you all. We have just a couple more minutes. Someone is thanking you all for your leadership. It's been a very challenging time to be a leader the last couple of years, especially during the pandemic. But can you talk a little bit about the practical ways that if someone's interested that's on this call, how can they get involved? How can they support your organizations or people in their community?
I'll go first. So for us, you certainly can go to the website, which is www.thepeopleconcern.org. There are volunteer opportunities. There are a way to support us financially. And I would also say, I know that there are many people that have participated on today's webinar that have been longtime supporters and donors, but also advocates as well, because I think that the systems change when they are pushed to change. And that comes from, I think, not just organizations like, those represented on the screen today, but there needs to be a groundswell from the community to really implement long-term change. So becoming an advocate in helping us to change the way that the work is done is critically important, as well as, of course, volunteer and financial support for all of our organizations.
Nick or Mark, anything else you'd like to add?
Ditto to what John said. Changelives.org is our URL. But one specific type of advocacy work, I think, addresses this issue of NIMBYism, right? When a project is proposed in a neighborhood, the negative voices will always be the loudest ones. And it's scary to go up against that, sometimes to go against what your neighbor is saying. But if we don't find ways to say yes, it's going to be really hard to solve this. So get engaged and have the courage to say yes.
Nick, there are truly, close us out?
There are truly so many ways, I think, to support, and that can be overwhelming. For our organization specifically, we'll send around like the website and socials, but in your community, there are people already doing the work, and you can help in whatever way makes sense for your schedule, for your budget, and for your skill set. There is always need, whether it be just uplifting a message on your own social media about an event that's going on, showing up to volunteer, lending in some time and resources any other way. A lot of the help organizations need is financial, but there are so many other ways also to contribute that if you go looking, you will find a way to help.
Thank you, Nick. And I'm going to just close out with that. I think you encapsulated it really lovely. I do just want to thank you all. There's a lot being echoed in the Q&A box. I don't know if you've had a chance to see it, but everyone's just thanking you all for your leadership. And I want to echo that as well during these, particularly difficult and challenging times, stepping up in your community and innovating and providing all the services and beyond, and trying to change our world is not easy always. So thank you so much for all of your work. I want to thank Nick, Mark, and John for all of your wisdom and everything that you've shared, and Kate for being our great organizer behind the scenes. And there'll be more discussions in this series, so look forward to that. And I think we're going to wrap it up. I don't know if anybody has anything else, or Kate, if you close us out, but thank you all for joining us today.